here we are. This is Sex Love Psychedelics, and I'm your host, Dr. Kat. Bringing you psychosexual conversations that will leave you intellectually turned on and hungry for more.
Yeah, I think people want to be safe in this. Our friend, yours and mine, our colleague, Michaela De La Maico.
Yes.
Yeah, I had an epic podcast with her. I'm going to encourage everybody to tune into that one if this is the question that you're in, especially for mamas who struggle with the stress or postpartum. Definitely check out that episode. She's created a big community around people who are in the inquiry and the research of that. Do you think that psilocybin in regards to hormones is the champion here, or do you see ketamine or MDMA? Do you see roles that they play, cannabis, in this in hormones? Yeah.
I'm glad you asked that. So because ketamine is our one legal, psychedelic type medicine that's currently in practice, and because it's been in practice in medicine for so long, there's a lot of research and scientific data about it.
Mm-hmm.
And there's just been a lot more interest and funding in terms of studies. And so I've seen applications for PMDD, which is premenstrual dysphoric disorder. It's a more intense and severe, version of PMS, which, a lot of us experience. And I've seen it in applications and studies for postpartum depression. I've seen some stuff about breastfeeding. So there's actually a lot, there's a lot of research out there. And so just for a little bit of background, what's interesting about ketamine is that it's a little bit different from the other antidepressant pharmacological agents out there. Instead of targeting serotonin or epinephrine and dopamine, it acts on your glutamate system, which is another neurotransmitter. Mm-hmm. And it increases synaptic plasticity and releases of other neurotransmitters. And it's what's interesting about it and what makes it so amazing in therapy is that it has amazing effectiveness in treatment-resistant cases, and it seems to work a lot more efficiently. Mm-hmm. And so what happens with PMS is that we know that depression isn't just an imbalance of different neurotransmitters. We know that it's beyond the chemical components that traditionally, the medical literature and science has shown. We know that mechanism is far more complex. However, we have noticed that people who experience depression or have depression symptoms have lower levels of glutamate. And so it seems that the ketamine can actually support levels by helping them rise. Mm-hmm. And so what people are trying now is that before they go into their period, before that week starts and they start experiencing those first symptoms, they actually go in for a session of ketamine therapy. And that is really helping them with mood regulation and the depression and the low energy, irritability that can accompany PMS and PMDD. That being said, I think, a lot of women deal with PMS and we're able to navigate it. So I see that this therapy is being used more for the severe version, which is PMDD. Yeah. And traditionally, I think we've been using SSRIs to manage this. And I think the effectiveness is only 60 to 70%, which is pretty low. So this could actually be a solution that could really support women.
Yeah, and it's more accessible to more populations. I think I've read the studies about moms who are breastfeeding being able to do ketamine for postpartum depression because it flushes out of the system in like less than 24 hours, and then they can go back to breastfeeding and
it has a short half-life.
It has a short, yeah. And so how can we help our mamas who really don't have that much resource around this stuff?
Exactly.
Yeah.
There's actually a study, it was like 650 women that were undergoing a C-section, and 10 minutes after childbirth, they gave them a dose. I think the dose is something like 0.5 milligram per kilogram, right? And there was a control group, and there was a noteworthy reduction in the occurrence of postpartum blues and depression amongst the women in the ketamine group. And that's just
God.
one dose 10 minutes after childbirth. And like you said, because it is fast acting with a short half-life, I think the recommendations are you can wait between 6 and 12 hours before breastfeeding again. And of course, if you want to err on the side of caution, you can definitely wait a little longer. But it's a drug that is relatively safe and has been in use for such a long time for people of all ages. It doesn't come without risk, of course, like many substances and drugs. But again, this is another promising application to support mamas.
Yeah.
You know?
Yeah, I love it.
Well, that was fun. Thanks for tuning in, lovers. And if you want to experience more ecstasy and sexual liberation, head over to sexlovepsychedelics.com and learn about how you can join me for any one of my online or live events. And while you're there, grab my free guide on sex and psychedelics. Remember, this podcast is for entertainment and educational purposes only. Please contact your healthcare provider and local law before pursuing any of the products or psychedelics discussed. And one final note here. I make this show specifically for you. If you're loving the show, then be sure to leave me a review in iTunes or Spotify to let me know. Happy to be here and happy to serve. I'll see you next time on Sex Love Psychedelics.